Hello, my name is Abizaid. I work at INCOR in São Paulo, Brazil, and it's my great pleasure to participate in this very important event. So I thank Professor Sharma, Professor Kini, and my good friend Roxana Meran and all the organizers for the very kind invitation. My mission in these next few minutes is to update you on next generation TAVR systems. These are my conflict of interests. This slide really illustrates how we started the whole TAVR field with two systems, the Edwards Sapient XT device, and then with core valve, and moved very fast to novel generation devices. These current generation devices are meant to improve TAVR performance, including decreasing vascular complication, paravalvular leak, pacemaker use, to name just a few. So today I selected 8 to 9 systems that are being used currently and that will come very soon to most of the cath labs in the world. And those are perhaps the most popular ones and the ones that are very, very promising. So let me start very quickly. I don't think I have to spend much time with the Sapient system. It's one of the precursors and the oldest that we tested. We started with that 17, 18 years ago with Professor Cribier, but there's a lot of changes. And perhaps the most important change recently is the Sapient 3 Ultra device, which really is this self-expandable valve, balloon expandable valve with open cells and made by cobalt chromium with this extended skirt that the company changed the fabric, so it's a more textured fabric as compared to the flat woven fabric in the past. So you can clearly see the difference between Sapient 3 and Ultra. So that certainly can improve the performance in terms of decreasing paravalvular leak. The sheet that Edwards put together is the Excella sheet, and essentially the concept is to have a 14 French device that accommodates a great matrix from 20 to 29 millimeter Sapient systems. And again, this is a sheet that gets into the femoral access with 14 French and expands for the valve to get inside and then comes back to the original size. So very good news for vascular complications. Very short movie to show you the concept for those who are not so familiar. Again, balloon expandable device, cobalt chromium, and you can clearly see the skirt that was built to decrease paravalvular leak. So very simple concept with an open cell and a short valve. We will guarantee will provide with good coronary access. Moving to the second system, and again, a very popular one by Medtronic, Evolute R Pro. And there is clearly change from first generation to the most recent generation. They were able to tailor height and shape, again, conformability and sealing, which is good news also for paravalvular leak, with a very circular cohabitation, which helps to avoid also the generation of the valve. And again, moving forward, Evolute Pro Plus is this device that you can see with an extended skirt as well to avoid leakage, and with Evolute FX, which will come very soon to the market. Portico will remind you a little bit the design of Evolute, but with some differences, as if you will. You see that the diamond's a little bit more open. Again, self-expandable nitinol valve. Probably the insertion of the leaflets is a little bit less high as compared to Pro, but it's still considered to be close to a supraannular solution. This is a short movie to show how this valve works. Again, self-expandable. As we retract the sheet, you're going to open the valve, you see the leaflets working, and then you can partially deploy and retrieve if the location is not perfect. So again, very similar concept, very much what you saw with the core valve system. The accurate NEO2 by Boston Scientific is perhaps the one that I have a larger experience since we performed the first in-man study in São Paulo, Brazil. So this is also a self-expandable valve with a supraannular solution. As you can see, the leaflets are higher than the annulus position. It has these 3 anchors really to help you to position and make the whole device more coaxial and more stable, so you can go ahead and do the final deployment. So remember, this valve has a 3-step procedure with the lower crown, upper crown, and the stabilization arches. So in this next few slides, you're going to see how this device works and how is the mechanism of action and how we deploy it. After the alignment, you retract the sheet and then you release the upper crown. So at this point, you can move the valve forward or backwards. The second step is to release the arches. So by doing that, you can really have a more fixed device, more centralized and stable, so you can go ahead and perform the last step, which is to move the sheet forward and release the lower crown. So then immediately the valve is working. So just a real life example. As you can see, after position, we release the upper crown. The second step is to release the arches. So then you see that automatically the system will be more centralized and very stable. So then you can go ahead and release the last step, which is the lower crown, and the valve will be in the right position. Again, self-expandable valve, and of course with next generation being released. This is the final result for this case with no leak in very good position. So I thought that would be interesting to show one slide with some data. And this is the data that we collected here in Brazil with our first 100 patients with long-term follow-up. This is a 5-year echo data showing the sustained result in terms of valve area. Here you can see in this blue line, and also with low gradient. So this is again mechanistical data with echocardiography as long as 60 months. So good performance, and of course we can discuss the recent results from scope 1 and 2 that I'm sure that is going to be one good point for discussion. But in our experience here in Brazil, with a good number of patients and good sizing and good planning, we have very sustained long-term results. Again, very good news is that all the studies so far has been performed with NEO, with accurate NEO. Now we have NEO2, which has this extended also a skirt. As you can see, most of the devices will come with this solution to decrease paravalvular leak, and accurate is also a good example of that. So very soon we're going to have more data on NEO2, and I think the performance will be much, much better than the ones that were tested in scope 1 and 2. GINA valve, also very interesting concept, because this valve can be a good option not only for aortic stenosis, but also for aortic insufficiency. And the reason why I'm saying that is because this valve has a mechanism that grabs the leaflets. And by doing that in less calcified valve, with there is a lot of regurgitation, this could be a fantastic solution. As you know, in most of the devices that we have available now, they are not perfect devices for aortic insufficiency. And this might be, you know, an official indication for AR. The other system that we had personal experience is the Allegra system by NVT that was recently acquired by Biosensors. Also another nitinol self-expandable valve. And this has perhaps the insertion of the leaflets is not so high, but as you can see, this is an interesting mechanism that releases the valve more in the middle and then towards the edges. So that makes the device a little bit more predictable in terms of deployment. And this is an example that we did here in our institution. As you can see, you release first the center and then you go towards the two edges. And that makes also the deployment a little bit more predictable. My valve from Mary Life Science is another balloon expandable valve. It reminds you a little bit the design of Sapient, as you can appreciate. There are some interesting features of this valve. It comes also pre-mounted, so it's already in the sheath when you deploy it. We don't have to do the maneuver to get the balloon inside the valve because it comes pre-crimped onto the balloon system. So this is the Python expandable introducer that Mary Life Sciences created. It's a special tissue that expands so it doesn't have that overlapping that most of the expandable sheath has. So I think that we'll have an interesting application since we need to be less traumatic with vascular access. This is a real life example, a case that was performed in India by Professor Sharma. So this is the position. You see that a very calcified valve, and this is the expansion and deployment. So good balloon expansion. And here on your right-hand side, you appreciate the final result. Again, good sizing and with no paravalvular leak. Finally, I would say that in some situations, better than any prosthesis is to have no prosthesis. So I think that the Leaflex by Picardia is a great example of a valvotomy device that can postpone a more definitive treatment or even do some kind of special cutting that will avoid any kind of permanent device. So this is again the concept in a short animation, the leaflet catheter advancing into the left ventricle. There is a deflecting catheter. Then you can proper position the device. You see the expander that was just unsheathed. And then the second piece is the frame, which you're gonna grab the leaflets in perhaps more than one or two orientations. So as you can observe, we're gonna do some good scoring of the calcium and release the leaflets, release the adherence. And by doing that, you're gonna monitor pressure measurements to see if you have a drop in gradient. So it's a very smart device that we can use either for preparation for a TAVR system, or this can be a standalone device. So very interesting, as now we are talking about treating younger patients, we're talking about durability. So this can be a fantastic alternative in the near future. So as you can see, the clear scoring as we expand the expander with the frame on multiple situations and multiple locations. So very interesting concept. So this is my conclusion slide saying that major improvements certainly have been made on TAVR technology during this past decade. TAVR indication has expanded to lower risk, as we all know, since there is no system that addresses all the limitations such as paravalvular leak, pacemaker use, vascular complication. We might have to customize the strategy based on clinical anatomical findings, and certainly proper training and case screening are the key for success. So keep in mind that very soon we're going to have multiple options, and we might be able to customize our choices based on certain anatomies and certain clinical indications. With that, I thank you so much for your attention.